Hello everyone. So today's topic is respiratory system. Organ is a organ of respiratory system. Nose, larynx, pharynx, trachea, bronchi, bronchioles, and lungs. There are first point nose and nasal cavity. Position and structure. The main route of air entry in that two cavity divided by septum. Anteriorly consists a hyaline cartilage. The roof is formed ethmoid bone. The floor is formed roof of the mouth. The medial wall formed by septum and lateral wall formed by maxilla. Respiratory function. The first of the respiratory passage. It is due to immune vascularity of the mucosa. Then second, filtering and cleansing. This occurs due to hairs which trap large particles. Third, humidification. As air travels over the moist mucosa, it becomes saturated with water vapor. Then second point, pharynx. What is the pharynx? The pharynx is the part of the throat that is behind the mouth and the nasal cavity and above the esophagus and the larynx. It is length 12 to 14 centimeter and extend from the base of the skull of the level is 6th cervical vertebra. Position: superiorly base of the skull, inferiorly continuous with the esophagus, anteriorly incomplete wall because of the nose, mouth and larynx opening, posteriorly areolar tissue and first 6 vertebra. Larynx. The larynx, position of the larynx. The larynx or voice box extends from the root of the tongue until the puberty. There is little difference in size of the larynx between the sexes. It grows larger in the male. Their position: superiorly the hyoid bone and roof of the tongue, inferiorly continuous with the trachea, anteriorly the mucus of the neck, and posteriorly the larynx and 3rd and 6th cervical vertebra. Then trachea. Trachea is a windpipe, is a continuous of the larynx and extend downwards to about the level of T5, where it divides into right and left primary bronchi. Length 10 to 11 centimeter. Position: superiorly the larynx, inferiorly the right and left bronchi, anteriorly upper part of the thyroid gland and lower part of the arch or aorta and the sternum, posteriorly the esophagus and laterally the lungs. Then bronchi and bronchioles. The true primary bronchi when the trachea divides about the level of T5. The right bronchus. This is a wider shooter and more vertical than the left bronchus. Length 2.5 centimeter. After entering the right lung, it divides into 3 bronchus, 1 to each lobe. The left bronchus, this is a narrow than the right. Length 5 centimeter. After entering the left lung, it divides into 2 bronchus, 1 to each lobe. Then function of the bronchi. It is control of air entry, warming and humidity, support and potency, cough relief, cough reflex, removal of particulate matter. Lungs. There are 2 lungs, one lying on each side, cone shape, weight 600 to 700 grams. length 20 to 24 centimeter, color pinkish. Lobe, 3 lobes in the right lung, 2 lobes in the left lung. Lobes are separated by the fissures. The area between the lungs is the mediastinum. Surfaces, apex, a base, costal surface and medial surface. Apex is the rounded and rises into the root of the neck. A base, this is a concave and semilunar in shape, lies on the thoracic surface of the diaphragm. Costal surface, this surface is a convex and lies against the costal cartilage. Then medial surface, the surface is a concave and has a roughly triangular shaped area called the hilum. The pulmonary artery supplying the lung and 2 pulmonary veins draining